Hi, my name is Dr. John Foster, and I am one of the hospital doctors at Holy Cross Hospital, which means I'm one of the group of doctors that takes care of inpatients at the hospital. We have been, as you know, dealing with the COVID-19 pandemic for about a year now, and the hospital asked me just to kind of present some updates about how COVID is doing and how we're doing with COVID in the kind of the local area of Taos. So that's what I'm going to talk about today. I've been following the numbers of infections and the rate of testing and that sort of thing that the New Mexico Department of Health publishes on their website and graphing a lot of that data. And I wanted to show you some of that and kind of to illustrate the patterns that's happened since the pandemic started. So in this first graph, you can see in the pink line is a graph of the percent of tests that are positive for COVID-19 since about last May or so. And as you can see, we had a big increase in November and through January, and it's just now since February begun to come down a little bit. That's one of the measures that the state tracks to determine how much of the state can reopen, and they call the red-green system, so that you need to have a less than 5% of the COVID tests be positive. And so you can see we've made some progress in that, and over the past month or so we've done better on that measure, and that's one of the reasons that Taos County turned green a couple of weeks ago. The other thing that they track is the number of new cases in the county per 100,000 population. And the goal for that is for that number to be less than 8. And we had been, as you can see on this graph, the purple line, we had been under 10 and under 8 actually up until sometime in October, and then the numbers kind of shot through the roof after that. And we've never got down to quite that level since then. We did get down the 2-week average of that number less than 8 a couple of weeks ago, and so that's why the county turned green. It has crept back up since then. I think either today or tomorrow the state will reevaluate the red-green criteria for the county. I'm guessing that we'll probably go back into the yellow, but the numbers that I have are from their raw data, and sometimes they make corrections to that data, so we'll see what they say, but I wouldn't be surprised. You know, Taos is a small enough community that just 1 or 2 families that have an outbreak of COVID can really change the numbers for our community. It doesn't take that many people with a positive diagnosis in a 2-week period of time to change us back from green to yellow, that sort of thing. And I can just tell you from the patients that we've seen here in the hospital with COVID-19, the majority of people in Taos County that are getting COVID are getting it from family members. So that's why it's still important to maintain the precautions that we've been doing. The next graph is similar. It's a little bit busier. I'll just explain what the numbers mean. So the blue lines are the daily cases, the daily new cases for each day since sometime in last May. And you can see the big spike starting in last October. The green line is the 7-day average number positive per day. And again, that number had gone down quite a bit as of February, but then recently started to increase again just this past couple of weeks. And then what's new on this graph is the gray line is the number of inpatients we have in the hospital. And so you can see that at our peak, we had up to 17 patients in the hospital at once with COVID-19. And then it's varied a lot since then, kind of bouncing around between 0 and 4 for the past couple of months. So we're still seeing people in Taos County get sick enough to have COVID-19 and require hospitalization. We are still seeing people die from COVID-19. It's not as much as we did back when we were really under the gun in November, but it's particularly difficult to see that these days because there's a vaccine available now, and there are some treatments available now that actually work pretty well if they're given early enough. And so it's stressful to take care of people, and it's sad to know that geez, if they had just had the opportunity to get the vaccine, or that if they had this treatment that we're going to talk about, we might have been able to prevent that hospitalization or that death. So that's kind of an update of where we are in the county. We're doing much better than we were a couple of months ago We have seen a recent small uptick. Hopefully that'll settle back down and we'll be back into the green category. So we all still need to keep our guard up, keep up the social distancing, the mask wearing, and that sort of thing. Keep up the precautions. So also, I just looked at the state's website yesterday, and as of yesterday, we'd had 49 deaths in Taos County from COVID-19. I suspect there will be more before we're through with this, but hopefully that will diminish quickly as the vaccine rollout progresses. So I want to talk a bit about prevention first, and then we'll talk about what's available for treatment. So prevention, the saying is an ounce of prevention is worth a pound of cure, and there's nothing that's more that applies to more than to COVID-19. Really, if we can prevent the infections from happening in the first place, that's really how we're going to get ourselves out of this pandemic. And I kind of think of it like a wildfire. The numbers can look better, but until we have enough people that are vaccinated, that we have a herd immunity effect from the vaccine or from natural infection, we're really it could flare up anywhere, and so we have to do our part to keep everybody protected. So the same things apply, that the masking, the avoiding crowds, and staying 6 feet away from people, those measures work, and that's how we've had the success that we've had so far. So that we need to keep that up as long as this pandemic is going on. And it's also very important that people that have symptoms of COVID-19 or that believe they might have had an exposure to it get checked for it and get tested, so that they can be isolated and not continue to spread it if they did contract it. So the vaccine. So that's the big news these days. There are now 3 vaccines available in the United States. There's slight differences. They're all 3 very effective. The first 2 were the Pfizer vaccine and the Moderna vaccine. Those are both 2-shot vaccines, require a second shot 3 or 4 weeks apart. And the studies on those showed 94 to 95% effectiveness in preventing symptomatic COVID-19. So both very good, very effective vaccines, and those are the ones that have been available in Taos County. There is a new vaccine that just got approval, made by Janssen or Johnson & Johnson. That's the same company. It's a 1-shot vaccine, and the effectiveness numbers that you'll see published on that are 67% effective. But I want to point out that if you just kind of look at that at the surface and say 67% versus 95%, well, maybe I want one of the first 2 vaccines. We're not really comparing apples to apples with those 2 numbers. So I'm going to show you a little bit of data from the Johnson & Johnson vaccine trial. And the first thing I want to show you is this page. It looks a little bit busy, but if you look over on the right-hand column, that VE%, that means vaccine effectiveness percent. And if you look under the first group of numbers is for the United States, and severe critical disease, it's 86% effective in preventing severe critical disease. It was actually 100% effective in preventing the need for hospitalization or death. And if you keep on down that page, you look under South Africa, it was 82% effective in preventing severe critical disease. And in Brazil, it was 87% effective in preventing severe or critical disease. So this is important, and this is why I'm saying we're not comparing apples to apples. The study that the Johnson & Johnson vaccine included large groups of people from countries where there are now variants that may be partially resistant to the previous vaccines. And so it's nice that Johnson & Johnson has given us data that shows that this vaccine is actually quite effective in preventing severe disease, not only in the United States, but also in countries where there are the newer variants. And so that, combined with the fact that it's only 1 shot, you don't have to go back for a second shot, and the fact that it's so far looks like near 100% protection against death or hospitalization, it's definitely a good vaccine, and my advice would be to take whatever vaccine you are first offered, and so you can get vaccinated as soon as possible. So Taos gets their vaccines from the state of New Mexico, and we don't have control over how many vaccines we get. We have the hospital, in cooperation with the town and the county and the school system and EMS and some others, and a lot of volunteers, has put together a vaccine distribution, call it a pod, that is capable of giving a lot more vaccines than what we've been able to get. Every week we place another order, and we administer as many vaccines as we get. The state, they actually don't know from week to week how many they're going to get from the federal government. So it makes it a little hard to say when the supply of vaccines will kind of increase. But most of the experts that I've talked to believe that we'll be getting a lot more vaccine over the next couple of months. The new vaccine, the Johnson & Johnson vaccine, Taos County has not received any of that to date. And I don't think the state itself expects to receive any more for the rest of this month. But starting in April, the supply of that vaccine we anticipate will start to increase dramatically. So that one may become available in Taos in April. I don't know for sure. Like I said, it's a week-to-week situation. All right, so moving on to treatment. To discuss treatment of COVID-19, it's important to understand that COVID has several phases of illness. The best treatment kind of depends on the phase of illness that you're in. The first phase of illness is when the virus is replicating quickly, and that's about the first week or so after infection or after symptoms first begin. There's actually a very good treatment for COVID-19 in that phase of the illness. They're called monoclonal antibodies. There are currently 3 combinations of monoclonal antibodies that are approved by the FDA. Here at Holy Cross in Taos, we have 2 of them. And anybody can be referred to get that treatment as long as they meet certain criteria. And when I say it's a good treatment, recent studies show really good results, as much as 70% reduction in the risk of progressing to need hospitalization or actually any medical care from COVID. So compared to people that didn't get the monoclonal antibodies, those that did were 70% less likely to need to go to the hospital. So we don't have anything else that comes close to that as far as an effectiveness, as far as treatment for COVID-19. The catch, however, is that it has to be given during that first phase of illness. So I'll say that again. We have a treatment that's very effective, but it has to be given before you become critically ill. Once you get to that second phase of illness where you need oxygen, you need to be hospitalized, the treatment is no longer effective. So you have to kind of anticipate that you might get critically ill and seek out the treatment. So basically this treatment of monoclonal antibodies, and there, like I said, there are several. I'll say the names. They're not easy to remember, but it's bamlanivimab is one of them we have, and the other one is REGEN-COV2, which is made by a company called Regeneron. That's the treatment you may remember that President Trump got when he was in the hospital with COVID. So as a group, they're called monoclonal antibodies. And I would encourage you, if you have been diagnosed with COVID-19, to talk to your doctor right away to see if you're a candidate for one of these treatments. Because like I said, they have to be given early before you progress to severe illness. But if you do get them, they are very effective in preventing that progression. Because there's not an infinite supply of it at this time, and the treatment has only been approved for groups of people that are at risk for progression. So anybody that's 65 years of older, anybody that has certain health conditions like obesity, type 2 diabetes, there's a number of others, but you can talk to your doctor and get a referral. It also has to be given within the first 10 days of illness. The sooner the better. So that's the best treatment we have for COVID-19, and it needs to be given in the first phase of illness. Once somebody is needing oxygen or needs to be hospitalized, there are other treatments we have, such as dexamethasone, remdesivir, and some others that provide some benefit. And then the major treatment is supportive care with oxygen. There's a host of other medications that have been proposed. Some have been shown already not to be effective. Others are promising but are still being studied. There's too many really to talk about in a brief presentation. But rest assured, we're kind of keeping our eye on the literature, and as soon as something is studied to the extent that we know that it's effective, we'll be using it to help our patients. Okay, so in review, we talked about 3 topics. Number 1, how we're doing in Taos County. We're doing quite well. There's been a small uptake in the past week or 2. Hopefully that will continue. That'll come back down, and we'll be back in the green. There are 3 vaccines that will soon be available to us. We have 2 of them in Taos County now. The 3rd one should be on the way. And they're all 3 very good vaccines, and my advice is to take whichever vaccine you're you have the first opportunity to take. And then finally, if you get COVID, talk to your doctor and to ask about treatment options, because there are options available. If you have any other questions about any topic related to COVID that you'd like either myself or Dr. Marshall to address, you can send them to marketing@taoshospital.org, and we'll get those questions and be happy to talk about them. Thank you very much.